Hello guys, hello today from our operation theater. Today I am going to be as much professional as anesthesiologist can be using surgical tools, and I would like to present you how to perform the simplest surgical stitches and how to close our surgical wound in a very simple way. So first of all, let's create a mess. Take the knife in your hand and we will do the surgical cut. But first of all, I will introduce our special patient today. This is the foot of the pig. This is the very common isolated organ, the most common isolated organ when we talk about surgical training, because this is the isolated organ with many different sites as well as many different tissue. So if you are going to train at home, you can buy a pig foot and perform for yourself the training related with the skin, stitches. Also, if you want to try to put the stitches onto subcutaneous tissue or deeper layers, including the muscle, including the tendons, and including the fascia, you can easily do this at the other side of the pig foot leg. Today, let's start from the basics of the basics. I will present you the simple continuous pattern and simple surgical stitch. If you take the knife in your hand and create a wound, always the operation wound has to be at this size which you feel comfortable in your with your operation field. So let's create small wound. Take your knife, go with that part to the skin and do with one swift movement, as we call this, surgical opening. We have very nice surgical wound. Surgical wounds are really so nice to close because the edges of that wound, as you can see here, they are very smooth. So after finishing our surgery, if we close them together, the healing process should be also undisturbed. That's why we call this surgical wound. For that reason, to close it, we need stitches. Where is my beloved assistant? Okay, to close our surgical wound, we need stitches. But when you do the surgery, always you have to have assistance to do this in aseptic way. What does it mean? You mustn't touch, the assistant mustn't touch the parts which I'm going to touch later on as a surgeon. So it has to be open in an aseptic way without touching of inner part of that stitch, and the assistant must put at my side near the operation my stitches. Thank you very much. And now I will brush up your knowledge a little bit with type of the suturing materials. To close the skin, to close the wound, I am going to use non-observable monofilament stitch because I'm going to take it out after 10 or 14 days of the healing process. We don't need it here anymore. If it does its job, we will take it out. So, also, I'm going to choose the cutting needle So this is the triangle symbol on our package. I'm going to use cutting needle because it will be convenient to go through the very, very hard skin of the animal. And as I mentioned before, this is the atraumatic type of the needle, which means the needle and the string is one. That is why we call this atraumatic. As you remember, we have different type of suturing materials. For closing the skin and simple stitches, we use non-observable materials because they won't go and we have to remove it after 10 or 14 days. But if we want to close something inside, like muscles, tendons, like fascia, we won't remove that stitches. So that is why they will stay inside our patient. They need to disappear after some times. We have different types, and depending what we want to do, what we want to close, how much time we need for a particular structure to be healed, to be closed, we will choose that type of absorbable stitches. So to close the wound, non-absorbable monofilament with cutting needle. How we do this? Maybe we will start from a continuous pattern, simple continuous pattern, because we have to begin our stitches in a very, very close relation to our wound, like a 3 or 4 millimeters from the beginning, and then we will continue. So now I will present you how to do this. Also, we need basic tools for this. One of them, you saw it. This is the pincette or surgical forceps, as you call it. This is the needle holder, the Hagar needle holder. Also, we need scissors, or also our knife will be available at that time. So we open it. We search for the needle to take it with our needle holder. And now, few words how to hold it. Always, this needle is very, very small. If we have in our hand the needle and the string, we need a needle holder to catch it in 1/3 of the length. Nice to have surgical forceps. And we have to begin our stitches just 3 to 4 millimeters from the beginning of our wound. You have to be very careful if at the beginning you have a really, really long string, because for sure, I can be sure of that it's going to tangle. And you will have small, small knots at the end of your, or along of your string. So how to begin? We have to perform surgical double loop, surgical knot, and 2 contra lateral knots, as like that. And this is the beginning stitch for our continuous pattern. 1/4 of the length, our surgical forceps, our extremely long line, and we continue this step by step. So one part of our skin, go in, go out, then the second part of the skin, and we go out with our needle. Yes. And we continue this as much as we have to. It is very, very important not to catch subcutaneous tissues, all the tissues under the skin, because it will disturb the wound healing and can be really painy for your patient. If we close the skin needs to be separately healing than other tissues. Let's do one more. We catch with surgical forceps one side, go in, go out, go in, and go out. You know what is more important? To do this in regular pattern, and these intervals should be almost the same, because when we finish our pattern, all the wound and all the parts of the wound should work, and the tension should be same in every part of our wound. So we continue this pattern. Now I will show you how to finish the continuous pattern. We begin, so we start, we have to finish. Same rule. You can ask me how I'm going to do this in the middle of our wound. I will show you. Go in, go out, go in, go out. And when you want to finish, you have to remember that you need a little bit length of that string to perform the same pattern like at the beginning. So you have to do the double loop, one contra lateral, and second one. Remember that your knots should be the beginning knot, and the finishing one should be a little bit on the side, not in line the wound. And when you finish this continuous pattern, you have to cut the extra length of your string. And as you can see here, this is the simple continuous pattern. Our wound is close, not so tight, not so loose, and you can be sure that it's going to heal really, really well. So another type of stitches. Now I will show you how to do this in the way that it's not continuous one, but we call this that this is simple interrupted stitches. And meanwhile, you have to think which pattern is more convenient and which pattern is better for our veterinary patient, and think about this why. So we go in, we go out, the same length, of course. Be careful not to tangle your string. We have to do this. We have to do this. The surgical knot and two contralateral ones. Stitch. I'm going to show you how to do this. The second and the third one. Surgical forceps are really, really best tools for this, because using that teeth, very, very sharp one, I can easily catch the skin and hold the skin in the way as I want. So go out, I lead my string, I perform double surgical knot. I'm trying to do my best to have it on the side, not in line. and do the same maneuver. So I'm going to cut the extra part of my string. Now look, the wound is closed in a very nice pattern. So I try to do at the same length. I do not have small holes here, so it means it works appropriately. I have my knots on the side, not in line the wound, and I do not have here in the middle inverted pattern or everted pattern. So it means this wound is appropriate close. Now I will explain you the mystery. Which one is better? The continuous pattern or simple interrupted pattern? The answer on this is our beloved patient that after especially 3 or 4 days of healing process, they started to be interested in our stitches because the inflammatory process and the healing process at that time is in the peak value. So it means that all our patients feels a little bit uncomfortable with alien body inside the skin. It's a little bit itching. They start to scratch. They start to be really interested. What is here? That they feel that this is alien body. Also, they have here extra length of the strings. So it starts to be really, really interested for them. And imagine the situation that if they will bite here and they will destroy one of these lines, so let's pretend. For example, if the dog or cat will scratch using the paws or the tooth, this line will be lost and all that pattern will be open again. So this is quite dangerous situation. Comparing to this pattern, imagine, let's create the situation that our dog will just bite through one of the lines. So only one of them will be lost, but rest of them will work in that wound during the healing process. So to be honest, for our patient, for our beloved patient, the interrupted pattern is safer than continuous one, because they will destroy, destroying one of the stitches, they will destroy all of the pattern. Here, when they destroyed only one of them, the rest of them will work. Also, remember that cone of shame, I think the most famous device for our dogs to prevent accidental wound, surgical wound injury, is very, very convenient in that situation. Because to prevent extra interest into the surgical wound, because surgical wounds are healed the best when nobody and nothing disturb that process. Guys, and one more information. As you can see, it takes time. It does not matter if you are going to perform continuous pattern or simple interrupted. Sometimes you face with life-threatening situation during our surgeries, or the clinical condition of our patient is extremely weak, and it is really, really extremely important to keep the time of general anesthesia, as well to decrease the time, to shorten the time of the surgery as much as it is possible. And for that reason, the mechanical suture was invented. Basically, it looks like a, as you can see, it looks like a simple staples in the office. You are right. We called it staplers. And this is the mechanical suture. So, step by step, we are able to put staples onto our skin to close both edges of the wound in a second. And this is the device with which save the time as well, save in a very situation, save the life of the patient. This is the mechanical stitches. As you can see here, there is no extra length of the strings, and there is no extra strings, so it is impossible for the dog or cat to remove it by themselves before us, because when we want to remove the mechanical stitches, we have to do this using special device which allows us to do it. At home, the dog and cat is not able to do this, so it is very, very good solution for our veterinary patients to save the time, to decrease the time under general anesthesia, to shorten time of the surgery, and also to fasten the post-operative recovery of our patient. Thank you very much. I show you how to do the mess and how to play the best. So it means how to close it in the simplest possible way. Thank you very much for our lovely meeting. Next meeting, I hope I show you how to close our surgical wounds in the easiest possible way.